Hello, my name is Dominic Silvestro. I'm a paramedic and EMS educator, and I've been in the field of EMS for over 25 years. Today I'd like to talk to you about a product that will aid you in pre-hospital and hospital cooling. We know that once ROSC is achieved, we want to cool our patients as quickly as possible. One of the products out there that we can use is the Cryothermic cooling system. The Cryothermic cooling system is designed to be applied by first responders and emergency department personnel as a bridge to hospital TTM. Remember though, follow your local protocols and guidelines for cooling when using this system, and remember too that this system can be applied both pre and post ROSC, so you can put it on during your cardiac arrests. The system's two parts, the first part being the collar itself. Collar is very similar to a normal extrication collar that you may have used 100 times or 1,000 times in your career. You apply it the same way. Patient's chin goes in the two cups here, the two plastic nubs, and then you wrap it around the patient's neck and attach the Velcro. Once applied, this is where it's a little different than a normal cervical collar. We have a trap door that's closed by Velcro again. Open that trap door and you've now exposed the bare neck and carotids of the patient. This is where the cooling pack comes in. The Cryothermic cooling pack is a non-invasive method of rapidly cooling. It's very similar to a normal ice pack you may have used. However, this pack is special. This pack cools to -5 degrees Celsius and will last 20 minutes. The most important thing though is to make sure you change that pack out every 20 minutes to maintain cooling, and also make sure that it has contact with the bare skin when you close the trap door. Next, I'd like to review how to apply the collar. First step would be to apply the collar as you would any other cervical collar, making sure that the chin lines up with the cup in the front. Feeding the collar underneath the patient's neck and attaching the Velcro. Open your trap door and ensure that your neck is clear of any clothing and the skin is bare for contact with the cooling pack. To use the cooling pack, break it just like you would any other ice pack. One quick punch. It's important to remember to vigorously shake this pack for up to 8 to 10 seconds. Once cool, simply insert it into the collar and close the trap door. Your cooling has begun. Note your time so that in another 20 minutes you can remember to change the pack. It's important to remember that we want to maintain cooling. We recommend that you change the pack out every 20 minutes. To do so, take a new pack and activate it. Again, vigorously shaking it for 8 to 10 seconds. Next, remove the old cooling pack and set aside. Insert the new cooling pack. Close the Velcro on the door, and again, note the time on your watch. It's important that we remember what time we applied it so that we can notify hospital personnel when the next 20 minutes is up so that a new change can be made.